As Arizona continues to face a shortage of doctors in rural areas, some medical experts say hardline immigration policies could deter young physicians born outside of the United States to fill up these roles.
I traveled to Sholo, a medically underserved area which is federally recognized as having few primary care providers. The impact foreign-born doctors are making in this Arizona mountain community is already huge. Osaf Ahmed has been a primary care physician in Arizona for over a decade, and he's seen firsthand the need for doctors in areas where it can be hard to get one.
The rural health is so important. These people cannot commute 3.5 hours in Phoenix just for a minor problem.
It's doctors like Ahmed, born in Pakistan and living in the U.S. since 1995, who play a critical role in underserved areas like Sholo, where he works at Summit Internal Medicine. According to a recent study by the University of Portland, just over 23% of doctors in Arizona are foreign-born, yet the state continues to face a doctor shortage. Arizona ranks 42nd in the country for active number of primary care physicians per 100,000 residents.
Roughly 30,000 first-year positions, residency positions across the United States. About 7,000 of those go to international medical graduates, with about 3,000 being U.S. citizens and about 4,000 being foreign-born.
Many rural clinics like Summit Internal Medicine rely on medical students to care for patients. That's why when there's a doctor shortage, these places get hit the hardest. Ahmed can see anywhere from 10 to 20 patients a day, and a majority of them are older residents who go in for checkups. Earl Richmond has gone through 3 doctors since moving to the area.
And when I find a good doctor like the one I have here, he's great. And what he does is he'll figure out or try and find the problem that you have.
But finding a trusted doctor isn't just an issue for the older generation. It also impacts those who need specialty doctors, like Sean Recob, who is transgender.
The smaller towns, typically you have more closed-minded communities sometimes. But to begin with that, obviously less doctors means there's less people who would handle such.
Despite the need, sometimes the immigration process is not easy for international doctors hoping to practice medicine in the U.S. Often, it can be discouraging.
There are so many steps which need to fall into the right place before you get here.
Once it does happen, the work these doctors do in rural areas is one they and their patients don't take for granted.
He's helped me a lot, more than a lot of the ones before.
I'm proud from where I am, but I think I'm prouder where I am today.
Since 2015, 3 hospitals in rural areas have closed in Arizona. The Robert Graham Center has predicted that Arizona would need a 50% increase in the state's current number of primary care physicians in order to keep up with demand. In the broadcast center, Abdel, Jiminez, Cronkite News.